Greetings all who have joined the session today. So we will be starting the session now. My name is Sonia and I'm from Empower School of Health. And this webinar is in collaboration with American Pharmaceutical Network, Kenya, our partner. And the webinar is on leadership and governance in the global health procurement and supply chain management. Now I would happy to introduce our moderator for today's session, Dr. Kelvin Odongo. Dr. Kelvin, the floor is yours. Please start the session. Thank you.
Thank you very much, Sonia. Hello to everyone, and thank you for joining us on today's call. It is my absolute pleasure to host you today and to be your moderator. As Sonia has rightfully mentioned, my name is Dr. Kelvin Odongo. I'm a pharmacist by profession and currently the chief pharmacist at Checkups Medical Center, and a chain of outpatient facilities that offer rapid and convenient healthcare to individuals here in Kenya, as well as in South Sudan. So it is my singular honor this moment to welcome you all to today's webinar. We are very optimistic that it's going to be insightful to you. It's going to provide a wealth of knowledge. The speakers that we have been privileged to have today hold a wealth of knowledge and many, many years of experience. They are experts in their own rights in this field of supply chain, and even more so in leadership. So I would want at this very moment to welcome you all and consider this session to have started, and welcome Dr. David Odhiambo of the African Pharmaceutical Network to join us on this call and just to give us a brief overview about the African Pharmaceutical Network and the partnership with the Empower School of Health. Thank you. Hello, Dr. David.
Yes, thank you, Kelvin. I was having some technical challenges unmuting myself, but I hope all is well now.
Yes, all is well. We can hear you loud and clear. If you could kindly have your video on. Thank you.
It's still blocked as well. It's still locked. I think, Sonia, maybe you could help me, could you facilitate that from your end?
Okay, no problem. David, you could proceed.
Okay, thank you. So I'm Odhiambo David, as has been mentioned. I'm a pharmacist by profession as well. And from an African Pharmaceutical Network perspective, we are glad to have these kind of engagements and these kind of discussions. And just to give you a brief background on what Africa Pharmaceutical Network is. So this is a network of pharmaceutical industry stakeholders that is from professionals, industry players, manufacturers, and related all across the Africa pharmaceutical industry. And on this account, our mission is to ensure that we have a common engagement platform where we could work on building capabilities of individuals, that is through knowledge sharing and training. And this is one of such engagements where we have industry leaders, industry experts coming in to share with us their perspectives and what future aspects, dimensions they see that can help us move towards our aspiration as a continent in ensuring we have reliable, continuous access to healthcare products and technologies and quality pharmaceutical care in the industry. And that is one thing that is very critical. And this idea and actually this concept came in mind when we were dealing with COVID-19, that was in 2020 July. And one of the key things we noted was, as much as there were shortfalls in African pharmaceutical industry in terms of supplies of the essential medicines and products, including offering of the medical services. Let's say, for example, we had products that were being fronted as cures, yet we have pharmaceutical specialists who are working in the continent. With how many of them were involved in actual assessment of these quality services and quality products, and actually it's seeing whether the medicines were effective or not effective. That is a component of pharmaceutical care, medication therapy monitoring and all that. So we realize that there's so much that's happening in the continent, and there are so many challenges that we are still also contending with. And the only way to overcome all these hurdles and these bottlenecks was to come together as industry players and industry stakeholders to chart the course towards a common future. And on that account, that is how we formed Africa Pharmaceutical Network. So there's the knowledge sharing and capacity building bit. At the same time, we know that the pharmaceutical industry is one of the most regulated sectors in the world. And on that account, then we need to find ways of working with each other and ensuring we are compliant with the regulation, but also the policies are responsive to ensure that innovation thrives and innovation helps us deliver on our mission. So that is where they look at it in terms of, do we have policies that are responsive and informed by current market dynamics and practices that can get us to the envisioned future? And then finally, business drives the world. And in that business, then it needs to be formed by being driven by people who are ethical, adopting the best leadership and governance principles as we're going to discuss today. And at the same time, these people need to be operating within the confines of the regulatory frameworks and policies that are in place. So those are the three key components. And on that account, we had an engagement with the Empower School of Health because of their technical capabilities and their growth in the healthcare capability building, that is training and education. And for these, we have this kind of engagement, but at the same time, they have academic programs that have been rolled out. I remember the last one we had start of the year was a postgraduate diploma in global health supply chain management. And now there's another program that is coming up, a master's program. And we're encouraging you all, let's take up these opportunities, let's learn, let's be the competent professionals that will drive African pharma agenda to the envisioned future that we all hope for. And on that account, I'll take it back to you, Kelvin Odongo, and hopefully we'll make the best of this. Thank you so much. Thank you all.
Thank you very much
for joining.
Thank you very much, Dr. David. One key message that I hear from African Pharmaceutical Network is to act as the link, a platform for all of us to be able to interact and share knowledge, share insights as we are going to do today. But it's also a very important link in the wealth of knowing what to do where, as we will learn from today's topic on supply chain management and leadership. So very briefly, I want to give Sonia an opportunity to also briefly talk about Empower, and then we can proceed. My humble request, and I'm going to be reading the housekeeping rules in just a few, but one of them that is very critical is that request that all of us participants have our videos and our audios off unless called upon to be able to speak. All right, so I would be requesting to you, each and every one of us to have our videos off and our mics off unless we are hoping to give a point or to speak. Please ask your questions using the chat box and by raising your hand as well, and we'll be able to then give you an opportunity to speak. We will be engaging our audience today in a series of polls to be able to get a feeling of who we have in this webinar, what your interests are, and to be able to also curate and plan future engagements that will be very laser focused on meeting your needs. So please, I would encourage each and every one of us today to participate in the polls that we would be displaying in the course of the presentation. The webinar recording will be available in the Empower School of Health YouTube channels, and Dr. David has assured me that in the African Pharmaceutical Network website, the video would also be available. The slide deck will be shared to all participants, provided your email address during registration. And I would, again, as I've mentioned, encourage all of us to be very proactive and to participate in today's engagement to make it not purely a lecture, but a session where we are able to then brainstorm together. To our panelists, Sonia, you could just move in. Thank you very much. To our panelists, I would request that you have your cameras on so that our audience is able to better engage with you. Please mute your microphone when your colleague is speaking, and please adhere to the webinar schedule timings, which I will be mentioning each time I give you a slot. Thank you so much, Sonia. Please, the floor is yours to speak briefly. Thank you.
Thank you, Dr. Kelvin. So, just give me a second. So before starting and introducing the Power School of Health, there will be a poll one. As mentioned by Dr. Kelvin, your participation is really needed to know you better. So I would request my backend team to please launch poll one. You can see there are a few questions that has been asked. Please select the selective answers. And this will be for a few seconds, and then we will show the results to you all.
Thank you.
Just you need to select the respective answers in front of the questions. Yeah, over to you, Dr. Kelvin.
Thank you, Sonia. It's important to note that our panelists, please do not end the poll. That would be left to me and Sonia to decide how soon it ends. But it's counting, and so far, thank you, ladies and gentlemen. I can see your responses are already coming in from my end. So I'll give a brief overview as soon as the results, the poll is complete. So keep responding. Keep the responses coming. We are currently at 42% of participation in the poll. Let us keep going. Fantastic. We've just almost hit the 50% mark. We have hit the 50% mark in terms of participation. Let's continue. Okay, currently at 70%. Just maybe a couple more seconds, then we can give the tally. Okay, Sonia, do I proceed to give the tally? Or give a few more minutes? We're currently at 68%.
Yeah, just we'll wait till 70 and
that's okay.
Ekta,
Yeah, we'll
please
give you
stop
a
the
bit more
polling.
time. Yes, that's okay, totally. And to our audience, this feedback is very important because we want to be able to design future engagements like this that would specifically then target your needs and respond to your needs as you will have given us feedback on these particular polls. So please do not feel shy to participate. And to everyone, Preksha has just posted on the chat for the latest updates and upcoming webinars. Feel free to follow the Empower School of Health on their social media, and you'll be able to get updates as well.
Dr. Kelvin, results are on screen. You can repeat.
All right. Thank you so much, Sonia. Thank you to everyone who's participated. So this is how we have fared in terms of the poll and the responses. We currently have 58% of us being male in this particular webinar and 42% female. In terms of age, bracket, and split, 37% of us are under 30 years old. Majority of us are between 30 and 40, that's at 39%. Between 40 and 50 years are 16%, and over 50 is at 8%. In terms of geographical split, Kenya leads at 48%, followed by elsewhere at 17%, West Africa at 16%. We come to Southern Africa at 14%, and finally, Central Africa at 5% in terms of participation in today's webinar. In terms of education or academic background, we have a majority holding a bachelor's degree in pharmacy, that's at 46%, closely followed by a pharmacy with an advanced degree in any area, which stands at 21%. We have non-pharmacy at 14%, coming in third at 14%. Pharmacy technician at 7%, other stands at 11%, and then finally we have pharmacy with PhD at 1%, being one member of the audience. Last but not least, how many years of work experience? In terms of years of work experience, I hope I'm still audible. Sonia, please confirm that.
Perfectly fine. Yes.
Okay, thank you. So how many years of work experience do you have seen so far? We have less than 5 years being 46%, followed by 6 to 10% being at 31%, followed by 6 to 10 years being at 31%. Thirdly, we have over 15 years at 16%. And lastly, 11 to 15 years at 7%. Thank you very much, ladies and gentlemen, for participating in our first poll of the day. Sonia, the floor is yours. You're welcome.
Thank you, Dr. Kelvin, and thank you, Dr. David, for your words that you have, delivered during the this session. And I would also, I'm also so glad for all the speakers who have available and who have confirmed their availability to, speak on the topic that has been decided for today's event. Now, I'm privileged to give the information about Empower School of Health being being a part of Empower School of Health itself. So as you can see, the offices, we have offices located in Geneva, New Delhi, Dhaka, Nairobi, Kathmandu. And I'll just give you more information about it. About Empower, Empower is a capacity building organization has worked over 100 countries across multiple languages and to strengthen the institutional and HR capacity of global health and humanitarian program through digital learning interventions. Our reach has already been reached out to 200,000 public health professionals globally. Also, you can see the focus area. We have 3 focus areas: leadership and change management, digital learning, public health procurement, and supply chain. The domain areas on which we are actually working: global health leadership, global health supply chain, COVID. You can see new product introduction, medical lab diagnostic training, health workforce strengthening. And on the left-hand side, you can see our clients with whom we are working, and we have already worked with them. This is the partnership, and basically our our partners across the globe, specifically in Africa for now. You can see we have also partnered with APN, and therefore we are organizing this session with them. So we can reach out to as many as people we can. And there are other partners also over here, which includes private institutions, universities, societies, councils, and Ministry of Health as well. These are our partners, clients, and funders. There are government bodies, UN agencies, donor agencies, academia, professional associations. These are our advisors and faculty members. Professor Paul Lalwani, he is the Director, Empower School of Health. Then Dr. Dennis Brown and Professor Andy, he is also a speaker for today's session. So Empower School of Health has many courses, and we have also recently launched master courses in global health procurement and supply chain management. And I'll just give you the brief on the later slides, because since we have recently launched this course, and we are receiving a very good response from. And also, I would like to inform you all that majority of our students are from pharmacy background. So so these are the courses. You can visit our website to check more about it. And anyways, more information will be provided to you later. This is the process for applying. We also we have a partial scholarship options for selective deserving candidates. There is a process for that. In order to know more about how to get enrolled yourself for partial scholarship program, you can either go to the website. There are the application form mentioned over there. You can fill up them, and the concerned team will get connected with you, or you can drop an email to the email IDs mentioned below, which is operations@empowerschoolofhealth.org and info@empowerswiss.org. And the team will get connected with you in reference to your enrollment to the specific course. We have masters, we have postgraduate courses, and we also have a short courses and a few free courses also. So if you want to explore, please visit our website that has been posted by Preksha on chat box. Now I would like to give floor back to Dr. Kelvin. Over to you. Thank you.
Thank you very much, Sonia, for the brief overview about Empower School of Health. Very insightful and quite a menu there to choose from in terms of courses. I believe there are questions that have already started streaming in through the chat that we will be able to respond to in the opportune moment. But thank you so much. At this very moment, ladies and gentlemen, this is usually the hardest part of any webinar because you can never really adequately describe men and women of such experience and knowledge. But very briefly, allow me introduce our very first speaker. Each speaker will get time slots of 15 minutes to be able to walk us through their wealth of knowledge and experience in leadership as well as supply chain. I have seen a question around how do we get certificates. So to all of us, we will be sharing a link later at the end of this webinar from which you'll be able to register for the certificate that will be emailed to your respective email addresses. So very briefly, we are privileged today. One of our speakers is Mr. Vinod Gupta. So Mr. Vinod Gupta, and allow me, I'm going to just give a very brief overview given the many accolades that he has. So Mr. Vinod Gupta is a Kenyan citizen with a qualification in BSc Chemistry and a business simulation from Apple Institute, USA, together with various crash courses of MPA for executives from IIM, Ahmedabad, and is certified in Advanced Management Program, Strategic Management Program, and Qualitative Techniques from the same university. Currently, in his position, he holds multiple positions, but I'll mention but a few also that are relevant to today's conversation. Is that Mr. Vinod is currently the vice chair of the Kenya Association of Pharmaceutical Industry, a platform that really handles a lot of supply chain, both in the private sector, but also in the public sector currently in Kenya. He's also a board director at the Kenya Healthcare Federation for over 10 years now, having worked with Kenya Healthcare Federation. He's the chairman, Supply Chain Committee at the Kenya Healthcare Federation, and is the chairman in the JCSC Committee of Awareness in Counterfeits. So he's done a lot of work over 10 years as well around counterfeits and just ensuring that we safeguard against counterfeits in our market. He's a board member and a member of Finance Committee and Resource Mobilization Committee of the Kenya Red Cross Society, Nairobi County, and is the current director, Health and Environment Committee, Hindu Council of Kenya. He's the second in command, Disaster Management Committee, Kenya Red Cross Society. And last but not least, is the past director of administration and vice chairman of Giants Group of Mustangs. It is important to also mention that Mr. Vinod is the current CEO of, as he is going to talk about very briefly, about what they do in the supply chain sector. But he loves social and community service, reading scientific notes, traveling, and believes in the slogan, be the change you want to see. He is the current CEO of MedSource. Welcome, Mr. Vinod. You could briefly say hello to the team, and when we can go through the session where you will be able to give us insights. Thank you.
Thank you, Kelvin, for that introduction. Are you able to hear me?
Yes, loud and clear, sir.
Right, and are you able to see me as well?
Yes, very clear. I love your background.
Thank you. Yeah, so it resonates with what I do. So yes, apart from thank you for such a wonderful description of what I do and what I handle in the industry. So I would like to tell the audience that I have over 30 years of experience in the same pharmaceutical healthcare related products supply chain industry, having traversed different continents across the world, including Southeast Asian continent, African continent, and I have not missed out the Latin. What I've missed out only is the European and the northern part of the hemisphere. So yes, it adds a lot of value to what I speak or what I garner in terms of my expertise and experience, having handled different countries with different populations, and it is not always the same strategy or same discussion for a similar situation in different countries with different languages. So yes, that's a small brief about me. Would you want me to talk about what MedSource is and what we do and how do I see the change in the industry?
Yes, please.
Great. So I started off, for many that may not be as old as the experience that I have. I started off with the times of telegrams and telex and typewriters. There was no computer anywhere even being mentioned. So that's how long time back I started my career. We have seen the industry moving from pagers, which I don't know, many of you may not know. So it's a small device that you hook onto your belt, and then you get a paging message saying that what kind of orders somebody's placing or what is needed out of you. You get to a phone booth, make those phone calls, reach out to people, and then try and resolve the issue that was addressed through that paging service network. It's again, it was an innovation in the telecom industry over 30 years back. So as we moved, then we got mobile phones as huge as the handsets that are used by the policemen right now. And now today, as we speak, we have mobile phones that are as small as our wallets. So why do I say this? It's in context of the industry innovations that have taken place, and health has never been left out of it. So there's plenty of innovations. Even today, we continue placing orders, making multiple phone calls. But fortunately, you have an ordering system that you can do online. You have emails that you write to your members or to your suppliers. Having said that, we still continue to spend a lot of time in the normal process of ordering, rather than looking at patients or serving the patients that come to your pharmacy or come to your health clinics or come to your hospitals. So this is where the innovation has come in, and Metsos as an innovator in the entire sub-Saharan Africa, it's a disruptor model. It has disrupted the entire supply chain. So what we do is we aggregate orders on the platform, and when I say aggregate, that we pick all the small 2s and 4s and 5s and 10s and 100s from different pharmacies and different clinics and hospitals and aggregate these orders on the platform, give a vetted customer base to the suppliers, and hence pre-negotiate catalog prices from the suppliers, and ensure that the customers that they're supplying to are vetted and are safe for them to be supplying to, and for the customers whom we call members, because it's a closed-knit platform. It's not come one comes. We serve all kind of a situation. So in this closed-knit platform, we actually provide a vetted product from approved or authorized importers and manufacturers, giving a peace of mind to the buyers that they have a product that is quality assured, and they have a product that they can be assured of serving their patient needs as well. So this is what we do. Apart from that, Metsos does quite a lot of innovative solutions into the market, including providing inventory financing, providing capacity building, because knowing fully well that many of the business owners or the ones running the pharmacies and clinics and hospitals are basically medical graduates and have a little or maybe a little bit more than the rest in terms of knowing how to run the business. So we build capacity, and all this comes free of cost. So inventory financing, that means advancement of credit, and including the capacity building, ensuring that the quality of products is all done free of cost to the members on the platform. So this is what we do, and I saw Empower had shown up a nice little logo of one of the only shareholder that I have, which is MSH. So MSH is our shareholder, and this idea was conceived way back in 2015, but the actual inceptualization took place in 2017. So we have been in operation. Well, the baby was born in 2017, but we have been in operation towards late 2019. 2020 is when we started actually serving the market, and that is when COVID hit. And it was an ideal time when patients or people couldn't go to the pharmacies couldn't get the distributors wouldn't be able to get the products, and hence the platform gave a very good visibility of what could be available at what time, in which part of the country or continent, and at what prices. So you may remember and you may know that there's plenty of skyrocketing of prices for commodities that related to COVID products during the time of COVID. So 2020, 2021, we have been able to serve very efficiently in the market by providing an online platform, and hence an automated ordering system, and hence an automated ordering supply chain. And this ensured that there was more strengthening of the supply chain. There was more strengthening of the service to the patient by also ensuring that the online pharmacies now got into play, and people started enjoying the benefits of the transition in technology, trying to help strengthen the supply chain. So with those few remarks of what we do and what kind of changes have happened in the industry, I would like to stop here. Kelvin, over to you.
Thank you very much, Mr. Vinod. And thank you for highlighting the role and the space that MedSource currently holds in the supply chain industry. You did mention the areas of operations, but I'm not sure if you did mention, you still have a few minutes left. So allow me and engage you for the benefit of the audience around. So the areas that the countries where you operate in, multiple questions will come in later from the chat about which areas you operate in. Is it only in Kenya at the moment? But even more important for our audience today is, what do you see as an opportunity for leadership and training in curricular development to shape the supply chain for the future?
Right, thank you. So to answer your first question, we currently are only based out of Kenya, knowing fully well that it's only 2 years of actual operations. So, but yes, I have the board approval for us to move into the sub-Saharan African market, starting with East Africa. And then probably we have been approached by entities from Nigeria and DRC, which has just now recently joined the East Africa community, for us to get into those markets as well. Remember, mine is an ERP, it's an online platform, so it's easy to scale. It's very easy to copy paste and a replicate model in terms of us operationalizing this in the different countries. So I'm just waiting for me to strengthen, learn more from this market that we exist in, so that there are no other learnings. We only go and implement our learnings and the best practices from Kenya into the different countries that we have been offered in terms of going and setting up the operations. So hopefully, if all goes well, by 2023, we should be in Uganda, Tanzania, DRC. Ethiopia was a market that was under consideration, but probably it may take some, we would have to lag this or probably park it on the side as we start also venturing into market analytics for Nigeria. So these are the few countries that we will be in 2023, starting 2024 as well. So that answers probably your first question. Second is, you know, like I said, from telegraphs to telex machines to today, the technology. So in the entire supply chain, I think what our young ones or the new ones into this market or into this space should always learn, that innovation is the need of the time. If you don't innovate, you will be stuck. If you don't innovate, you will be left far behind, and hence will not be able to succeed or move ahead with the market. So number one, move in with the innovation, keep yourself abreast of what's changing. Given my age, remember, I've always been in the supply chain, started like with what the story I gave. But today I am handling or heading an entity that handles digital platform, which now ensures there's a connection, there's visibility, there's data analytics, there's artificial intelligence. Nothing of this was known to me when I started my career or even when I finished my university degree. So if you do not innovate, you will never be a leader in the space. If you do not innovate, if you do not change with time, you will never be able to sustain your own existence in the market. So these are a few thoughts that I would like to give to the participants on this program. Kelvin, over to you.
Thank you. Thank you very much. Hello, can you hear me?
Yes, I can hear you now.
Fantastic. So my last question to you, really for the benefit of the audience, Mr. Vinod, is what are some of the best practices in supply chain that you would recommend to our audience today?
So, you know, when you say supply chain, there are a few things that people need to keep in mind. One, are you ensuring that there is no illegal trade? Are you ensuring that there's no counterfeits that are getting into the supply chain? And hence, vetting the supplier is very important. Ensuring that it's not always about price, but it's about quality. Yes, price does play an important role, but how do you reduce cost so that the patient gets the best benefit out of the medications that they come to you, or they approach the pharmacy or the clinic hospitals that they would go to in terms of getting the service? So many a times in the industry, what people go for is price, but remember, cheap is always expensive. So you must vet the quality, you must vet the supply chain before getting into the question of price. I'm sure Toyota and Nissan will also sell in the same market that Mercedes and the BMWs and the Tesla will sell. So there's always a market for everyone. It's about how best you manage who's supplying those products, and do you have a backup for all those items that you need. Because remember, let me give you an example. Let's say you buy a glucose test machine, and then you buy a test that comes free with it. You go to the same supplier or pharmacy that you bought the glucose test machine and ask for the strip. There's no strip. You mean to say, did you make a wrong investment? Of course, yes. You should have gone for the best available product to be supplied together with the availability of the consumables, which is the strip in this case that I mentioned. So in the supply chain, what is very important is continuity. In the supply chain, what is very important is quality. So these are two main parameters that I would like to ensure that the audience understands of what to remember when placing orders, or what to remember while making a purchase through the supply chain. Over.
Thank you. Thank you very much, Mr. Vinod. Our time is almost up. I'll just do a quick recap, especially on your last points. That in the supply chain industry.
Kelvin.
Yes.
I see one question. Do you want to take that up on the chat box?
I saw it on the chat box. We will come and do a question and answer session in just a bit.
Sure.
Thank you. So just to summarize, Mr. Vinod, I might not capture everything, but my take home from you is that in the supply chain industry, two things that are important: quality and continuity. And of course, you have to then look at your costs and avoid illegal practices. I am certain, in my experience, one of the other things that is very critical is, do you have the right human resource, right? Do you have the right person who has the requisite qualifications to deliver on the job, right? Because then they would be able to assess on the quality properly. They would be able to manage your supply chain adequately. And I guess that's also why Empower School of Health is very interested in ensuring that we equip individuals who we are then able to release to the market. So thank you very much, Mr. Vinod. We will move on to our next speaker for the day. Stay with us, Mr. Vinod, because we will have the question and answer session in just a bit. So ladies and gentlemen, very quickly, our next speaker, again, I cannot adequately give honor to Mr. and Dr. Hakim Rabuka Kiboi, who is an expert in the supply chain. He is the general manager and company pharmacist at Signature Healthcare Limited, and chief executive and co-founder at Rock Health Integrated Care, ORG. He spans a wealth of experience for both the corporate and humanitarian world. A lot of what he's done around humanitarian world is with Rock Health Integrated Care, ORG. With Signature, he oversees compliance of the company's supply chain to both international and local regulations. He leads the first blue company pharmaceutical with compliances spanning ISO and WHO GDP, as well as the first edge eco-green pharmaceutical warehouses in Africa. With RICO, he has led leading epidemic responses to malaria in Baringo County and the control of endemic tropical diseases in 8 other counties in Kenya, in partnership with both local and global actors of health. He's an associate fellow of the Royal Commonwealth Society and a FEMA awardee under the Projects for Health category. He enjoys hiking, high mountains, vast plains, and forests. He says that conquering nature proves that you can conquer new fronts and new heights. All you have to do is do it. So ladies and gentlemen, let's welcome Dr. Hakim Rabuka Kiboi. He forgot to mention that he is also a Rotarian, a practicing and active Rotarian. Dr. Hakim, welcome.
Thank you very much, Rotarian Dr. Kelvin Odongo. I need to remember that once I'm called upon to speak in the future. Yes, I am a Rotarian as well. Thank you for this wonderful opportunity, and good afternoon to everyone. I listened to Mr. Vinod, and some of these items that he's mentioned are really critical. Talking about quality as well as also price reduction. I listened to Dr. David Odhiambo also speak about policy responsiveness, and basically that's ideally what governance entails. And I'll strive to touch a lot on issues to touch on vulnerability of the supply chain and the active players in supply chains. inability to mitigate potential risks. Because as we say, we have what we call black swan events, and I will allude to the black swan events that we shall see in the next few slides, which apparently are the disruptions and the distractions that we expect in the supply chain management. So yes, that's my name. I work with Signature Healthcare Limited, and Signature Healthcare Limited is what you have seen, what Dr. Odongo has just mentioned. So yes, leadership and governance in global health. Please proceed to the next slide. All right. So many a times we don't really want to go very deep into definitions, but it's quite important to understand ideally what the topic entails. From different angles, you could be forced to think that global leadership and governance in global health procurement and supply chain management is a merger of about 3 or 4 topics. But ideally, we're going to major a lot on leadership and governance, and I'll share a bit of what I have seen so far, even with working with in the humanitarian field as well as also in the corporate field. When we want to involve a set of players, we want to involve procedures, information resources at both national and global level in order to be able to integrate key business processes. And that is ideally what supply chain management is, to satisfy our organization's customers, clients, beneficiaries. Remember that you are your own customer as well, and the employees and human resource in each and every system also are customers and clients. And we want to probably, as we do supply chain management, you're looking at, you cannot talk about supply chain management without speaking about inventory, storage, global health system at a global level, risk management, which is what we're going to really hit hard on, and technologies as well. So this ideally is global health procurement. Please proceed to the next slide. Next slide, please. Okay, so challenges. This will go into the black swan events. I think we're very much partisan to issues that have occurred since the 16th century to date, and I think we cannot also talk about challenges in the global supply chain if we don't talk about COVID-19. And this has been alluded to. So COVID-19 pandemic has really opened up our minds to our own vulnerabilities. If you look at the next slide, you will be able to note that one of the biggest factors and this is something that happened to most of us. Some of us had suppliers who said, hey, sorry, we're closed due to COVID-19. Yet this was your single supplier, and you actually relied 100% on this supplier. So what really happens? Your business, is dead. You're not able to really supply to your customers. And if you look at the next slide, we'll now dig further into our own vulnerabilities, which is what I really want us to expose in ourselves as companies, as individuals, as a system, both at the national level and the global level. Next slide, please. You will be able to see that one of the biggest issues that affect us today include our own vulnerabilities. We are not able to really pick out what particular areas our organizations or companies are inconsistent with or insufficient in. And Dr. Odongo, please, could you set it out to the next slide? Would like to move forward.
Okay, there you go.
Next slide, yes.
That's
right.
it, or we go to the next one? This one, yeah?
That's okay, that's okay.
Thank
All right.
you.
Many times when we talk about supply chain management, we also want to mention things to do with reducing overhead expenses. You want to reduce inventory, you want to only work with just-in-time inventory, while at the same time also increasing asset utilization. Now, this has been a traditional way of thinking, and this kind of advocacy has actually led to the removal of buffers. So you find that companies currently in the supply chain do not have sufficient buffers. And there's also subsequent reduction in the flexibility to actually absorb unanticipated disruptions. Like the black swan events that we're seeing, we're not really able to prepare adequately. So not being aware of these vulnerabilities, especially during things like natural disasters, trade wars are also pertinent to remember, global pandemics. Then we actually also have low investments in risk management measures. I'll give a very specific example to the pharmaceutical industry and how disruptions and distractions actually amount to considerable losses. An average of 24%, according to McKinsey Global, of 1 year's total earnings of companies in the pharmaceutical industry, 24% is lost out of total earnings before interest, taxes, depreciation, and amortization. Now, this might actually be lost subconsciously, but we lose that on a daily basis because we are not aware of areas in which we need to really build up in order to avert certain risks. Now, if you look at the next slide, and I'd like to reiterate that internal risks have been found to be much more the positive factor in disruptions of the supply chain. You're looking at mismanagement. You're looking at our inability to be accountable, to be responsible, to be transparent, which are actually leadership and governance issues that we shall speak about much later. Now, this is a slide that actually also stipulates that the pharmaceutical industry loses the 24%, but it's not adversely affected by disruptions and distractions as opposed to other players, other manufacturing industries. But I want us to stop thinking in a linear fashion, because always we think that we are alone in the pharmaceutical industry, we are alone in the healthcare setup, we are alone in a global health, at a global health level. There's an aspect of who are the actors of global health and who are the global health actors. Those are very two different things. Now, if you look at commercial aerospace, automotive, mining, textiles, chemicals, food and beverage, they may not directly be involved in the pharmaceutical business, but they are indirectly involved. They could actually be a tier 1, tier 2, tier 3 supplier to a certain process of manufacturing and excipients, for instance. Yeah. So the pharmaceutical industry is least affected, yes, because of the huge inventory that we also contain, as well as also the low cost of production as compared to other industries. But at the same time, when other industries are affected, they also affect our pharmaceutical setup. Let's go to another example. Next slide, please. This study was done by McKinsey. Another good example that I also experienced personally as a pharmacist working in signature healthcare, especially during the COVID-19 period, was the insufficient supply of certain APIs and the insufficient supply of certain excipients. Now, you would actually think that excipients and APIs are produced everywhere. That's also a wrong assumption. If you look at this particular slide, it alludes to the projected growth of the excipients being produced by different parts of the world. And you can see that to the top right, top left, China, India, South Korea, and Brazil were actually in 2018, right before we had the outbreak, were projected to have one of the highest compound annual growth rates in terms of exports or production of excipients to other countries globally. But this actually hides the fact that we are relying on a very small source of excipients, for instance, and I think this came out very evidently when we went out of stock of paracetamol, for instance, which we were supposed to be used as analgesics in our COVID-19 patients. We could also see an insufficient supply of excipients. This is another vulnerability that we have as a country, as a continent, and also globally. Next slide, please. All right. We also saw what happened at Wuhan in China. You find that over 200 of the Fortune 500 companies have a direct base in Wuhan in China. And you have companies that also have a tier 1 supplier. Tier 1 suppliers are those that supply directly to you. You have about 900 and something companies which are tier 1 suppliers based in Wuhan, and about 250 which had tier 2 and tier 3 and beyond suppliers who are based in Wuhan. So this is a very interesting thing that we learned, and not just China. I'm sure there are other countries like India. When China, the world's factory is impacted, we have actually seen a global supply chain being disrupted. Next slide, please. So these are actually the vulnerabilities that we're looking at. The over-reliance on certain sources, certain parts of the world to actually help us manage our pharmaceutical supply chain. Let's look at Africa. And this is a diagram that shows us how many manufacturing companies we have per country. For instance, in Kenya, you will find that we have about 30 to 40 manufacturers in the country. Some countries are not doing so well because they have 0 or 1 or 2. Now, what does this also show us? It shows us that if one of the countries in Africa, which we are relying on for the purposes of production of pharmaceutical health products, then if they are impacted in any way because of any disruption or destruction, then we ultimately affect our own supply of medicines. And as you can see, it's not by chance. It actually happened that there are 3 main factors that could explain the high concentration of manufacturers in a country. Could be the legacy, national trade and industrial policies, a strong local demand, which are aspects also surrounding leadership and governance that we will be able to look at. But this is also a vulnerability. Next slide, please. So we have seen 3 so far types of vulnerabilities. We've looked at our manufacturers, we've looked at our excipients, and one other challenge that we have in the supply chain is globalization-based complexity of supply chains. Now, it is paradoxical also. We wouldn't actually expect that globalization would make a supply chain simpler, but what has actually happened is the pharmaceutical procurement and supply chain have actually grown in complexity. And this is because you find that pharmaceutical companies are growing into multiple geographical areas in manufacture, in distribution, testing, and also you're seeing quite a number of multi-tier system, a company relying on the different companies which are supplied by different companies and so on and so forth, with even sub-tiers. So this actually obscures our ability to do what we call an end-to-end viability. An end-to-end viability of the supply chain actually ensures that you're able to audit the whole value chain from yourself to the tier 1 supplier, tier 2, tier 3 supplier, and all the way to the last person in terms of data security, finances, operations, regulation, reputation, and structure. And at times we've seen that if a company went bankrupt, it actually affects the whole supply chain. Why? It is because companies did not do an intrinsic audit of the value chain from end to end in order to identify how strong the supply chain is. Please, next slide.
Dr. Hakim,
Yes.
I might have to disrupt you in less than a minute, so you could wrap up. Thank you.
All right. Please just let's move on. This is how complex it has become from a linear kind of supply chain to a more complex supply chain. Next slide, please. All right, and the sectoral challenge as well. We are seeing that most of us in play in the pharmaceutical industry are also not aware of what is happening in other sectors. For instance, in the trade sector, how does WTO affect the supply chain of pharmaceutical products? And security and education and many other sectors that are what we call actors of global health in procurement and supply chain. Please, next slide.
Dr. Hakim, we've run out of time, so I'll give you 30 seconds to wrap up.
All right, I'd like us to jump to the next slide. This is still on sectoral challenge and the sovereignty challenge. In as much as we are seeing, please proceed. In as much as we are seeing that we've had global organizations also improving our global governance, we still have our national governments still primarily making decisions on how global supply chains need to perform. Next slide, please, as we see that happening, and into leadership and governance. Sovereignty challenge. So we still are sovereign nation states, and this actually make global supply chains our national responsibility. Next slide, please. I want us to go into leadership and governance in summary, pertaining the principles of Dr. Kevin.
Yes, so we might have to give you that slot in the Q&A session. Hopefully then we're able to touch on the leadership aspect, if that's okay, Doc, so that we're able to keep time.
All right, no problem.
Okay, thank you. So just to recap, and thank you, Dr. Hakim. Just a quick recap. One thing, again, you have emphasized on what Mr. Vinod had said. As a leader in the supply chain, you cannot overlook the cost. So cost is a big driver. You cannot overlook the fact that there's quality that you need to look at. And then you are encouraging our listeners today to think broadly and collaborate with the non-farmer, especially in the aspect that they also indirectly affect the farmer supply chain in a way, right? And then lastly, and I think this will come in later, but it's very interesting to note that as Africa in itself, there is really an opportunity to also be self-reliant, or really to be self-reliant and create even bigger impact in terms of planning, in terms of the capacity to do local manufacturing. Then we have West Africa, Nigeria significantly leading in that line. And then East Africa, we have Kenya. So that is very helpful, Dr. Hakim. And hopefully we will be able to give you more opportunity to elaborate in the Q&A session. So very quickly then we can move on to our last presenter for the day. You can move the slide to the next section. Thank you. Thank you very much. Ladies and gentlemen, our next speaker has over 30 years experience, yeah? And like I said, it is an incredible honor to really be able to host you and to have you, Prof, speak to us today, and to empower us and to educate us and really give us insights that you have been able to acquire in the course of your practice. So Professor Andy is the Professor of Public Health and Director of Training at the Empower School of Health. He is one of the co-authors of the Yellow Book, Managing Drug Supplies by MSH and WHO, and the e-handbook of Health Systems in Action for Managing Medicines. He has over 30 years of experience of working in healthcare procurement and supply chain in low and middle income countries. The main focus of his experience includes effective management of pharmaceuticals, vaccines, and medical commodities, and especially the implementation of programs for the introduction of new medicines and rapid diagnostics for neglected tropical diseases. He has presented on leadership training and good governance of health procurement and supply chain functions at many conferences, seminars, and webinars like this, and has authored the good governance chapters and assisted in developing the leadership training course for the Empower School of Health Master's Degree course in healthcare procurement and supply chain management. Professor Andy, thank you so much and welcome.
Greetings to all. Let's go to the next slide, please. And then, okay, and again to the next, please. Okay, so I'm afraid I'm going to talk rather quickly, but you will get the slide deck, and there's lots of URL links and references on the slides which you can go. I start by saying there's often a bit of misunderstanding about leadership and management. People somehow think they're two entirely different things. Well, leadership and management are not the same, but they are inseparable. They are linked. Most managers have elements of leadership, and most leaders have to have some management skills. The two are linked together. So too often we have this artificial fight between leadership and management. And we have to try and resolve that and recognize that whilst they are different, there's a huge area of overlap between the two. And in fact, many of us play both functions. Next slide, please. If we look at leadership and management, we can see that really it's the same thing, but done in different ways. So we look at leadership, we lead based on trust, whereas in management, we often have a degree of control. We can dictate what happens. Leadership, we often have to encourage and foster cooperation. Well, in fact, in management, that's increasingly the case now as well. Dictatorial management is still prevalent, but it's less so. We get much more coordination, much more cooperation now. So the skills are becoming overlapped and interlinked. It's really two sides of the same coin when we talk about leadership and management. And too often we try to separate them out and say they're completely different. And then we lose the plot quite a lot. Next slide, please. One of the big issues is that in Africa in particular, but in most low-income countries around the world, public health leadership is lacking, especially in procurement and supply chain. And we look at all the different quotes on the screen and all the different places we see where it's missing. We get problems that don't exist, which are blown out of proportion, and real problems which are not addressed because we don't have the leaders tackling those problems. We don't have the innovation. We don't have the far-sighted people bringing the solutions that could happen. We're stuck in, we've always done it that way, so we always will do it that way. And that's no formula for success in the modern world. The leadership is going beyond what we're doing now, being able to see further. And bringing those leadership skills is critical. In the past, we tend to focus very much on management and day-to-day operations and not the leadership elements. We need both. We can't neglect either. We still need the management, but we need that element of leadership coming along as well. Another key point there is too often we're adopting Western high-income countries' techniques and management theories. They're not appropriate to our environment. That's not what we are working in. We're working in an environment where cooperation is key, where interaction is key. And we have to have facilities and techniques and methodologies which are appropriate to Africa, not just imported from the West. Not that everything from the West is wrong, but is it appropriate for our environment? And we're not asking that question often enough to develop an African perspective on what's happening. Next slide, please. Well, can we grow leaders? Surely leaders are born. Well, I want to dispel that myth completely. Yes, a few leaders are born, but the vast majority acquire leadership as a skill. If we look at the latest academic research, and the link is in very small type on the bottom of the screen, the recent studies suggest that leadership is 30% genetic, 30% innate, and 70% is learned. We can grow leaders. We can give people the skills to become leaders. And that's the fundamental concept of my talk on leadership. We can make leaders. The vast majority of people who can undertake management can undertake leadership. Leadership can be made. Next slide, please. Well, okay, but how do we grow leaders? And again, we come back to this. We've not been very successful in the past because we're trying to import Western high-income country techniques. We have to start with an African perspective, appropriate for our environment. One of the activities that Empower has been involved in is to link with the private sector. There aren't yet that many leaders in public sector, public health supply chain. They're not there yet. There are some, but not many. So we have to look at the private sector, where there are far more leaders available, and cooperate with them and link and develop those skills into the private sector. And using a cooperation with Johnson & Johnson, the Empower School of Health, and the INSEED Research Group, we've tried to put that together, trying to link in those leadership skills which are already there in Africa with people in the public health sector who want to try and develop procurement supply chain leaderships. And the key point about this, it is peer-to-peer learning. It's not white-haired old professors on a blackboard with chalk talking away. It is talking to people who are doing the job, chief executive officers, who are in day-to-day activities of leadership. And that's the key component I want to stress. Next slide, please. So this key component we call mentoring. People who are already doing the job, helping to assist people who are starting out into this field. They've already had some academic training, they've already had the talk and chalk, the didactic learning, but how do they actually apply it in the field? How do you relate to challenges? And this is the point around that. And a special case there is around women in leadership. Far too often it's the old white-haired men who run everything, and we don't bring the female perspective. So the Women in Leadership Circle is particularly important in bringing that perspective and bringing those female leaders who are largely in the private sector to help develop those skills in the public sector as well. And that means coaching, mentoring, one-to-one activities. What happens when this goes wrong? What do I do about this? With real life people doing the job, not management theory. Next slide, please. So why is this mentorship so important? Why can't I just do an MBA course and then I'll know everything? Well, if we look at research from Democratic Republic of Congo, they had classroom-based training, and they said, yeah, that was pretty good. We all enjoyed that. That was useful, helpful, but it's not enough. I still can't apply it. I don't know how to link this theory with actually doing the job. What they wanted, what they always identified, was on-the-job mentoring. Being able to turn to someone who is actually doing the job in the field and saying, what do I do about this? What are my options? And that mentoring is the key, and it's evidence-based. It is a whole body of research showing that mentoring is key to developing leadership. Next slide, please. Well, did it work? Pretty good, yeah. You'll see the results on the screen. It worked pretty well. It was the first step, developing it together, come through. Reasonable success stories. People enjoyed it. They liked the links together. They liked being able to cooperate so well together. Next slide, please. So what does it mean? Leadership in public health, procurement and supply chain is essential. We have to start looking to the future, and that's what leaders bring. Leadership skills can be learned. You don't have to rely on born leaders. But leadership training in PSM is needed, but it must have an African perspective. It must be appropriate and focused. And that means through mentoring. Next slide, please, and I'll try and finish in just 2 or 3 minutes. Good governance in public health, procurement and supply chain. Straight on to the next slide, please. It needs to be part of good governance in healthcare, the total public health function. Procurement and supply chain is one part of that, but we need as a starting point good governance in healthcare. And we use the UN WHO definition. It's long established. Over 30 years ago, when I wasn't an old man, the definitions were written. They're all present, a long time there. Next slide, please. There is a consensus now about exactly what we mean by good governance. There's been a lot of debate for about 10 years on exactly what we mean, but we've got it nailed down now. Well, that's all very good, but I'm a pharmacist. I can't tell the government they've got to have good governance. No, you can't, but you can understand the importance of good governance. You can behave ethically and follow the guidance on good governance, thereby promoting it through doing. Next slide, please. There's very detailed information on how you set about undertaking a good governance of medicine program. It's been established for over 30 years. All the information is there from the World Health Organization. Links are on the screen to find out more. Next slide, please. Very detailed how we stop counterfeiting and substandard drugs, how we look at unethical promotions, All aspects of it are covered in the WHO documentation. Next slide, please. So what are we trying to do? Raise awareness, prevent corruption, increase transparency and accountability and integrity across the whole range of good governance in medicines. Again, lots of good information from WHO. The links are on the screen. Next slide, please. There's a WHO three-step process. Quite a lot of the countries who are present today on the webinar will already have the National Transparency Assessment. You can already see phase 1 is complete and you're into phase 2. Try and follow that through. Become aware of what's happening on good governance on medicines in your country. Next slide, please. Well, did it work? Is this good governance really any good? We look at the example of Thailand, who has gone through the entire system and implemented it and included it in the faculties of pharmacy. So it's now compulsory for all undergraduate pharmacists to learn about good governance in medicine. Massive impact, lower cost for medicines, about 20%. They've reduced the cost of the medicines by bringing in this good governance program. Much more than that, they have transparency and accountability. They have built trust. People now trust the public sector procurement and supply chain management. Next slide, please. If you want to learn more about good governance, there's a new free online training course. The link is on the screen. It's about a 3-hour course and you will get a certificate. Next slide, please. So leadership and management are inseparable. We need both. Leadership skills can be taught, but we need this African perspective. Good governance in medicines is well established. We really should be implementing it now, and it brings real evidence-based proven benefits. All it requires is a systematic approach and an overarching commitment to follow good governance. Next slide, please. Okay, that's me done. Thank you.
Thank you very much, Prof, for that very insightful presentation and really very practical, even in terms of responses that we can easily pick up. My take home is that leadership and management are inseparable. And while we are looking at leadership, we need to be very keen to give it an African perspective, even in terms of the solutions. We need to look at the private sector where we might benefit more from a wider pool of individuals or professionals who would then be able to support our supply chain. And we have to then cooperate with them to be able to really improve the system. There's someone who said that we have to learn by doing. We could participate in governance by actually doing. And thank you for encouraging us or really shedding light on the role of mentorship and peer-to-peer learning in developing and nurturing and bringing forth good leaders who would then be able to take this industry to the next level. You have encouraged us to really focus on on-job training and mentoring because that's where you get the requisite skills in a practical setting. So thank you very much. And then finally, it is very important, and I think this is very true now, even in our context, that people now trust the public supply chain, and these efforts have not come overnight, but it's been a process, and we are very grateful that it's actually possible to achieve by doing. So very briefly, thank you so much. Before we move into the Q&A session, I would want to welcome Sonia, very briefly, Sonia, to talk about the master's program, and then we'll enter our Q&A session. Thank you. Keep your questions coming. I will then be reading them to our panelists for the day to respond.
Thank you, Dr. Kelvin. So just as I informed you all earlier, we have recently launched master course, and you can check the websites, our website, that is Empower School of Health, and it is also posted on the chat box by Priksha. You just need to visit the website, click on this link, fill up your application form, and the concerned team will get connected with you. Or we have a partial scholarship specifically for the participants who have attended this webinar. So please get connected with APN directly or Dr. David. please submit your request to them. And once we will receive the recommendation from them, then your application will be considered for the partial scholarship with the reduced fee on the original pricing. For original pricing, you can visit the website. The fee structure, everything, content, topics are mentioned on the website itself. So for we have very limited seats for partial scholarship. So attendees, please get connected with Dr. David from APN to submit your request to them. And once we will receive the consolidated sheet, we will get back to you on the same. That's all from your end. And one more thing, we have two categories under master course. One is for 12-month course that is specifically for PGD graduates from Empower School of Health. And for all others, you can enroll to 24-month course, master course. And it is completely an online course, which you can do as per your convenience. Thank you so much. For any query, questions, you can get connected with me.
Thank you. Thank you very much, Sonia. And very quickly, we will just go ahead and dive to the Q&A session. So I'm going to read out the questions and I'll then give our panelists an opportunity to respond. Starting with the latest question, what could be the best practice in acquisition and sustaining good leadership and management in healthcare supply chain? Question to Prof. What could be the best practice in acquisition and sustaining good leadership and management in healthcare supply chain?
There's a wealth of WHO documents which describe practice from a number of countries. Certainly go ahead and read them. The links are on the slides. Look at what's available, a lot of information. The best practice is to start the process. It's a three-phase process, get it started. Most countries have already done phase one, the transparency study, be aware of it and look at phase two. And you can start now just by observing good governance yourself in your own day-to-day operations.
Thank you. Thank you very much, Prof. The next question, and maybe Dr. Hakim can take it, and then Mr. Vinod. So the question is, in your opinion, will African Medicines Regulatory Harmonization / African Medicines Agency improve the paradox of globalization in supply chain? I repeat, in your opinion, will African Medicines Regulatory Harmonization or the African Medicines Agency improve the paradox of globalization in supply chain? Dr. Hakim, you can go first, then Mr. Vinod, and lastly, Prof.
Thank you. So the disclaimer here should be that our aim is not to actually reduce the complexity, but to evolve with that complexity. The complexity is not a negative thing. It actually means that we are getting more connected with the increasing visibility of globalization. I think what we need to be looking at is foresight towards being able to grow with the technological growth that we are seeing globalization comes with. And we're also seeing our ability to also encrypt end-to-end, our ability to see through the supply chain. And I think the AMRH will actually improve the end-to-end transparency. But the complexity is something we will need to actually grow with and evolve with. That's my response.
Thank you.
Thank you. Dr. Kelvin, we have seen a bit of success with the ESC harmonization, as well as also the one in Southern Africa, the Zazibona, which is similar to the ESC harmonization. We are seeing quite some improvement in the timelines required for the registration of products, for instance. So yes, we can see some improvement.
Thank you. Thank you, Doc. Mr. Vinod, you could go next. I know Mr. Vinod had requested to drop off briefly. So maybe, Prof, you could go next as we wait for Mr. Vinod.
Yes, I think that the harmonization will have a very positive effect because, as you said, you're increasing transparency. You're also increasing volume, and that gives you more buying power. And that buying power helps you to force transparency and helps you to force ethical behavior. So yes, it's a very positive progression. That's all from me.
Thank you very much, Prof. Sonia, you could help Mr. Vinod unmute. He wants to respond, but he is not able to unmute. So please assist him in that. But in the meantime, as we are waiting on Mr. Vinod, the second part of that question is any, specifically in addition to the 3 challenges in local manufacturing you mentioned, shouldn't cost of production be part of this? All right. And this, I believe, is specifically to Dr. Hakim. In addition to the 3 challenges in local manufacturing that you did mention, shouldn't cost of production be part of this, e.g. power, skill, HR, etc.?
Mm-hmm. Yes, we can never run away from the discussion on price reduction as also a factor that we will aim at equitably distributing pharmaceutical and health products across the globe. It's a matter of, are we maintaining the quality even with price reduction, and what do we need to do in order to reduce the price? Not tampering with certain ingredients, for instance, not tampering with the quality of the API, for instance. But rather, I'd say if we are able to expand or rather increase the diversity of suppliers we actually rely on, then we might be able to land on cheaper methods and cheaper suppliers. And the term here should not be cheaper, but more affordable sources of ingredients that are used in the pharmaceutical industry. So yes, that's a topic that needs to be discussed. But let's look at the quality as the determinant in this situation.
Thank you. Thank you so much, Dr. Hakim. Mr. Vinod, are you back? Is your audio working now?
Yes, I'm back. I was always there, but somehow the audio and video had been switched off. But yeah, thank you. Yeah. With regard to the harmonization, in fact, I've been part of the committee that has been working on this for the past over 5 years. So like what Hakim was mentioning, we have been able to achieve quite a bit, but more so specific in the East African continent. Otherwise, there's a lot of intergovernmental agency collaboration that needs to be worked out. There needs to be a strengthening of the porous borders. There needs to be enhancement in terms of capacity building for people to understand when you say harmonization, what it actually entails in terms of controls and in terms of procedures, and in terms of each one following what needs to be followed. So yes, I had partly answered to this question on the chat as well, but a lot has been done. A little more needs to be done as well. So we have to cross many bridges. There are a lot of red carpet that we need to walk, and doors to be knocked as well. So I'm sure with time and with the generations coming, we'll take the work that we have managed to do so far, and take it forward from there. So the message is, yes, we will see the light at the end of the tunnel, and it's not too far away. Over.
Thank you. Thank you, Mr. Vinod. The next question really is, and this you can respond to immediately, does Medsource source and supply raw materials and packaging materials for pharmaceutical manufacturing?
Yeah, thank you. In fact, we do not do anything with regard to APIs or with packaging material, but yes, the entire spectra in the healthcare, we call it HPT in today's terminology. During our days, it was more of pharmaceuticals and consumables. So it's called HPTs, means everything related to healthcare products and technologies is supplied on the platform, but no raw materials or packaging material for now. Over.
Thank you. Thank you very much. And the next question, and Prof, you could go first in responding to this. Do you think investing or supporting the central medical store without capacitating the public health delivery system?
Well, you need to do everything, of course. You can't just do one section without the other. It's all interconnected. So supporting the central medical stores is essential, but it doesn't work if there's no distribution. So everything has to work. I mean, you can argue that building roads is part of procurement supply chain management because it helps the distribution. So everything is linked together. You have to do all. The point around capacitation is we're still looking at talk and chalk. We're still looking at taking people out of the job and putting them in a classroom for 2 weeks, rather than on-the-job training, rather than linking it together, rather than using online learning and bite-sized pieces of learning to put that together. So capacity building has to change. The way we look at it has to change. And with that, yes, across the whole spectrum needs to happen. But let's get away from the talk and chalk and classrooms and doing it on the job, mentoring and putting together.
Thank you. Thank you very much, Prof. The next question, and this will go to Dr. Hakim. Has any progress, and then maybe Mr. Vinod can also respond, has any progress been made on incorporating good governance in healthcare supply chain in pharmacy schools in Africa?
Well, if you talk about the whole continent, then I'd say that I'd be lying if I said I knew everything that's happening in each and every country. But I can definitely allude to some of the successes. Yes, we are doing some things right. We are not there yet, and that's why we are having such webinars, such good discussions. Now, in the curriculum, especially for these pharmacy schools, we are seeing that leadership and governance comes in, yes, as part of the curriculum. It's part of the unit. But the question is theoretizing. There's a difference between theory and practicality. Now, if we learn too much of terms and not really give any reference to current situations in the country, for instance, and even on a global scale, then we're not able to internalize that particular discussion in the classroom. But so my push is for the practicality to be included. I mean, it's going to be tough to do this on a leadership and governance class, but I think alluding to very specific examples, inviting individuals who are known to I have done online classes with individuals who are renowned for certain things in leadership and governance or in a certain topic, who would speak about their experiences. I think that's what we can learn even from Professor Andy, from your experiences. We can be able to internalize better as opposed to theoretizing. Yes, we are doing it, and I'm glad that we are having it in the country. I am not sure about other countries, but I hope they can also include it in that. One thing that we are doing as Signature is inculcating that when students come here for attachments and internships, which we have done, and we have done in partnership with Kenyatta University, in which case we helped them develop a curriculum that enabled the insertion of very crucial topics that had been left out, and other universities as well in the country. So that's my input to that.
Thank you, Dr. Hakim. And very quickly, two more questions, one for Prof and one for Mr. Vinod. So to Mr. Vinod, thanks for the great presentation. My question is, what do you think is the best way of ensuring good governance for PSM activities, e.g. procurement, that is conducted by donor agencies with minimal participation of public institutions like the MOH and CMS?
That's a little bit of a tough question, though, because you can never dissociate public against the private. There are people who come to the private for internships and go to the public. There are people that are in the public have been trained by, people from the private that have been trained by the public institutions as well. So I would rather say that it's about learning to experience and expertise sharing. Coupled with that, I think what Hakim just mentioned, we have to look at ways of how the private sector or how industries can come and ensure that those subjects or curriculum that are not picked up in the schools or universities are best managed in terms of giving expertise, or at least sharing knowledge in terms of the best practices with regard to such the chapters that could be actually totally missed out. I must also mention that MSH has picked this up in many countries and is trying to circumnavigate to ensure that the curriculums could pick up, could be inclusive of governance as well. So probably that's my take on this. Over.
Thank you. And finally, for Prof, do you think that, just a minute, so that I pick the questions all together, what is your thought on donor-based programs lead to lack of, donor-based programs lead to lack of leadership and poor management of medicines in low and middle income countries? Do you agree, Prof?
I think it's very mixed picture. There are some excellent programs that develop leaders, that support leadership activities, and they are generally more in abundance now. But there are still some which, yeah, basically the donor does everything and the country just receives the medicines. Those are withering away. But most programs now come with an element of technical assistance of developing leaders. The leaders may not stay in the public sector. Many of them move on to the private sector. And I think what you've got to ask is, why will they not stay in the public sector? So there are good leaders developed by donor programs. It is improving, it is getting better, but part of it is recipient countries need to be a little more dynamic in interacting with donors. Tell the donors no, tell the donors what you want. Yeah? I mean, one of the worst offenders is Global Fund, but once they're told, they will normally act. They will normally support leadership development, but they will only do that if you include it into your grant. Less than 15% of Global Fund grant applications have any technical assistance whatsoever. It's just give us the medicine and we'll take care of it. Global Fund will support that if you put it in the grant. So it's a little bit chicken and egg. Countries are not asking for leadership development and donors are not providing it.
Thank you. Thank you. Very, very clear. Thank you, Prof. And unfortunately to our panelists, I know there are questions that still remain unanswered. Hopefully we would be able to then share those questions with our panelists and be able to circulate the responses as and when we get them back to you. I've seen a lot of requests for the slides to be shared. Rest assured that we would be circulating that at the end of this call. With regards to how we get the certificate, and I'll invite Sonia in just a bit to be able to get that, to tell us about that in terms of how we register to get the certificate. So very quickly, we have come to the end of the Q&A session. Thank you to our panelists for those very insightful responses. Thank you to our audience who have also been very interactive. It shows that you are very keen and you are very interested in a topic, and I'm looking forward to probably a follow-on conversation on the same topic to really be able to open up this conversation a bit further and get even more solutions moving forward. So at this very point, I would want for Sonia, if you could put up our second poll so that we get quick responses on the same. Thank you. All right, so ladies and gentlemen, this is our second poll. Please feel free to participate in terms of responding. Thank you.
Thank you, speakers. Thank you, everybody, for your time which you have spent on this session. The certificate link has already been posted on chat box. Just you need to fill up the form and the certificate will be sent to your registered email ID. The poll has already been launched. You just need to select the respective answers in front of the questions. And in a couple of minutes, we will end the poll and show the results to you all. Thank you.
Also, for the benefit of the audience, Dr. David has posted quite a lot of information on how you can get in touch with African Pharmaceutical Network. Sonia and team have posted a lot of information on the chat as well, how you can get to read more about the courses, the LinkedIn profiles, the socials are all in the chat. So I encourage us, let's keep voting, let's keep voting. I hope we can all see the link for registering for the certificate. Okay, we are at 65% in terms of participation. I'll encourage us to continue participating. Thank you. Okay, Let's keep going, 68%. We're almost there. Okay, I can see some of us have already started receiving the certificate. So it is automated a certificate. So you proceed and generate that very quickly. Thank you, Sonia and team, for making it very efficient. Okay, we are at 68%. Let's keep voting, ladies and gentlemen.
Dr. Kelvin, you can share the results. I
Okay,
think it's been
thank you.
reflecting on your screen. Yeah.
All right. So very quickly, in terms of our second poll, the first question was, what percentage of the information was new to you? All right. And we have 67% of us saying this information was new to them. So thank you very much to our panelists for this, for the very many insights you've given us today. We have 21% of us saying below 50% of this information was new to them, and 13% saying 100% of the information was new. Okay, and then second question is, after this webinar, would you like to enroll for the courses offered by Empower School of Health in collaboration with APN? 87% of us say yes, they are interested in enrolling for the course. 3% of us say no, and 10% of us say other. Thirdly, how did the session compare to your expectations? Excellent. 56% of us feel the session was excellent. 42% of us feel it was good. 2% feel it was fair, and 1% feel it was poor. We are hoping that we would be able to continue meeting your expectations and get the satisfaction rate to even higher ratings with your feedback. And then the fourth question, sorry, just a minute. How likely are you to recommend this session to a colleague, with 10 being most likely to recommend? So we have 83% of us saying that they are most likely to recommend this course to their colleagues. 17% are ranging between 4 and 7 in terms of recommendation, and 1% between 0 and 3. So thank you very much. Your feedback, as I'd mentioned earlier, is very important, because for future sessions, we want to be able to design and to keep improving and to keep making these sessions better. And the goal is to really be able to customize them to respond to the respective needs that our audience has. So thank you very much. And in keeping really with what Prof had said, that we have to move to a step where we are more practical in our solutions. So that is our goal here at APN, as well as Empower School of Health. So at this very juncture, allow me to hand over to Sonia and to the APN team to give their closing remarks. But mine to you, my audience, and to our panelists is to say a very big thank you. And as we say it here in Kenya, asanteni sana for making time to join us on today's webinar. And we hope to see you in many more to come. Sonia, over to you, and Dr. David. Thank you.
Thank you, Dr. Kelvin. I am really thankful to you to smoothly take this session, and also the speakers, and most importantly, all the participants who have attended the session. We will surely be organizing such sessions in future, and everything will be posted on our social media page. And anyways, you all will be informed before time if we'll be organizing such sessions with APN or any other partner. With APN, surely we'll be having another session, most probably in next month, that will be posted on the social media. And as informed to you all, please get connected with Dr. David. He's from APN to apply for partial scholarship for the course. The master course is in English language, also is in French. So who are comfortable for French language, they can, enroll themselves for French course. Now I would like to give this floor to Dr. David. Few words from you, Doctor. Thank you.
Thank you so much, Sonia. Thank you, our panelists, Prof. Andy, Hakim, and Vinod. It's been a pleasure listening to you, gaining the insight, and I'm hopeful that we are going to put this into action. From my end, the main encouragement to the participants, I see we've come to the end with over 180 participants. This is commendable, and I believe it's the task for us to gain knowledge and practice this. So the encouragement would be then let's take advantage of the learning opportunities that are being presented by the Empower School of Global Health. There are 3 programs actually. Today we're launching the master's program, but other than the master's, there's the postgraduate diploma still in place, and there's the certificate program. So what we'll do after this particular webinar is to share that information with you and with the different packages in terms of the scholarship percentage waivers that you're going to get. So take advantage of these, sign up for the programs, and let's see how we can work to deliver our continent from the challenges that we're having and actually be part of the solution. And I really like the aspect that Prof. Andy brought in the fact that when you're asking yourself that the leaders are not doing it, the question is, are you doing it wherever you practice? Because there's never a way we are going to point fingers and say people are not doing their part, yet wherever we are also not doing what is needed of us. So if you're able to do that, we'll be able to change the dynamics and deliver our continent from the challenges we are going through and ensure that we have reliable access to safe, effective, and quality medicines to people when and where they need them, because we all aspire to achieve that. So how do we make that happen? Thank you so much, and I really appreciate, and let's engage as we keep the conversations going. I've shared on the chat as well our LinkedIn page and the LinkedIn group as well, plus the email. Reach out, let's have the conversation going. You feel you have something that we need to engage on, we are more than glad to collaborate and ensure that we drive a common agenda for the African continent pharma industry. Thank you so much.
Thank you very much, David. Thank you, Sonia, and to the entire APN and Empower School of Health fraternity for making this possible for us. To our panelists, once again, thank you, thank you. We know you are gentlemen with very busy schedules, so we appreciate your sacrifice to be able to be with us today. And to our audience today, thank you as well for showing your thirst and really your dedication to make sure that our supply chain and in general our practice in the supply chain industry is improved. We are hoping that we will be able to meet those expectations moving forward through the master's program and the programs that are offered by Empower School of Health, but also through the initiatives that have been rolled out and in the pipeline by the African Pharmaceutical Network. So mine at this moment is to say thank you. Sonia, unless there are any other remarks, I would want to say thank you to everyone and to call this webinar session to an end at this very juncture. Thank you.
Thank you, Kelvin, and thank you, everyone.
Thank you all.
Thank you.
All right.